Russell Norman.
Thank you, Mr Speaker. I rise on behalf of the Green Party to speak on this, the ACT Party's spending cap bill. The Green Party won't be supporting the spending cap bill from the ACT Party. This bill, the effect of this bill will be that over time government spending as a proportion of GDP will decline. It will effectively cause a real reduction in government services over time. That would be the practical import of the bill. This bill comes and is driven by the ACT Party's belief that I'm sure is very genuinely held that government is to be seen. Government should have a very small role in society. It should maintain the rules, and that's about it. And that all the other things government does are seen from the ACT Party's point of view to be a constraint on our freedom and a constraint on our ability to do things for ourselves. So the ACT Party takes the view that we should reduce government spending and reduce taxation, reduce regulation, and so forth. And it's good on the ACT Party for having a set of beliefs which it brings to this place, but we don't think that we don't agree with the beliefs that the ACT Party puts forward. Rather than subscribing in a kind of a philosophy of a freedom from, which underpins the ACT Party view, a freedom from government intervention, the Green Party much more subscribes to an idea of freedom to. We see the role of government in collective action when we all work together, that it actually increases our freedoms rather than reduces them. I mean, take for example, if we think about public education. Public education is a very expensive impost on the government and the taxpayer. We all contribute to pay for public education, and yet public education adds to our freedom. It means that all children, regardless of where they come from in our country, get given a fair chance to get an education, which adds tremendously to their ability to experience life and to make the most of their abilities and their talents. Actually, public education actually adds to their freedom. And so the fact that we all pay taxes and that we all contribute sufficiently so that we have a proper public education system so that all children in New Zealand have access to it, on the one hand, from perhaps an ACT Party point of view, is a constraint on all of us because we all have to pay taxes to do that. But I would argue that collectively adds to our collective freedom because it means that all of us and all of our children have the opportunity to get a decent education so that they can be fully fulfilled and reach their potential. So we have a different perspective on paying taxes to pay for public health and public education. Public health is, of course, another example. On the one hand, you could view the taxes we pay for public health as an impost, as a constraint on our freedom. We all hand over taxes so that there's this public health system. So any one of us here and in New Zealand, when we get sick or when we're in an accident, we know that we have access to a public health system so that we can be looked after and hopefully brought back to good health. Now, I wouldn't view that, the fact that we pay taxes to support public health, as a problem. I see that as a great addition to our freedom. The fact that we can walk around knowing that if something terrible happens to us or we get a terrible disease, that actually the public health system will be there for us actually adds to our freedom. It's not a constraint on our freedom that we have to pay taxes for a public health system. Actually, collectively, by all of us chipping in, it means that individually we are all effectively insured by the whole. All of us contributing together gives us that freedom. And that freedom wouldn't be available. Now, you could argue that you could have private healthcare, but basically private healthcare in New Zealand is entirely dependent on the public health system. At the end of the day, if something really terrible happens to you, you always end up in the public health system because the private health system can't actually do the kind of treatments that the public health system can. And also it's the problem for the poor. If you don't have the money to pay for private health insurance, then basically if there isn't a public health system to support you, then your freedom and your life opportunities are reduced dramatically if you are unfortunate enough to have an accident or you're unfortunate enough to get a disease which means that you need expensive treatment. I'm sure many people in this House and of course right across New Zealand, we all have experience either personally or of people close to us or in our extended family of people that have had illnesses or accidents and have had tremendous support from the public health system. That adds to our freedom. The fact that we have access to public health gives us all the assurance that we can go about our daily lives without having to live in fear that should anything happen to us, we won't get access to the public health we need. So I would say to the ACT Party, you may see taxes as a constraint on our freedom, and collective action and government as a constraint on our freedom. From the Green Party's point of view, we see those kind of collective contributions that actually give us all the security that we need actually adds to our freedom. If we don't have that basic security, no matter where you come from, that you can access decent health, decent education, then fundamentally your freedom is constrained. And that's why we don't think about a kind of a freedom from government intervention, which is, I know how the ACT Party sees it, this terrible burden that the government, they see as on top of all of us. We see it that the government enables us to increase our freedom so that we can do the kinds of things that we really want to do. This, of course, and this is slightly at a tangent, Mr Speaker, also applies to regulation. So there's a similar philosophy within ACT and the ACT view about regulation, and so they're always trying to restrict regulation. There are times when regulation actually is very important, whether it's in leaky houses, where we saw when you remove the regulation protecting consumers, actually it's cost us all $20 billion to fix up leaky houses. And so I would argue that that is another example where the philosophy that sits behind this bill, which is, I'm sure, genuinely held and honestly expressed, nonetheless I think is a mistaken philosophy. Now, nobody's saying that we want absolute government spending to be 100% of GDP. Nobody's saying that government can't over-regulate and cause harm. Of course it can. But we do think that putting this kind of constraint on the ability of the government to spend money when it needs to actually over time will result in a decline in the provision of real government services as government spending as a proportion of GDP declines. And we will find a cut over time in the quality and quantity of the government services that we all rely upon and that actually all increase our freedom. So for those reasons, the Green Party won't be supporting this bill tonight. Thank you.
David Bennett.
Thank you, Mr Speaker. Just want to take a call on the spending cap.